I'm reading about this debate about DSM-5. A lot of literature has been recently published in journals and also in psychiatric times. And what I think is that the DSM has proven to increase some kind of reliability. And we all know the history of DSM. We know the studies of US, UK, and the study of being sane in insane places in the beginning of the 70s, which showed us that the reliability of psychiatric diagnosis was very low. Today, the challenge that we face is less reliability because the DSM achieves some kind of reliability, but more validity. The DSM is not valid because it's not brain-related. There is a consensus that that mental disorders are brain disorders, and we know that the DSM is unrelated to the brain. What we need to do now is to make this big leap from the clinical phenomena to the etiology or etiology of the brain disorder. This is very hard to do because the brain is very complex, and it looks like mental disorders are disorders of some kind of high complexity disturbances in the brain. But we do have the sciences that can help us understand this kind of transition. We have neural network modeling, we have neural computation, we have complex system sciences, which can help us make this transition, this leap, where on one side we can investigate the clinical phenomena, and then using these sciences we can predict and presume what would be the brain dynamic perturbation or disorder. Actually, I have tried to use this kind of insights from neural network modeling and to create some kind of transitional matrix that on one side you have a clinical phenomena of the patient, and this matrix predicts what will be the brain disturbance of the patient. For example, there is a lot of literature showing that patients with psychosis might have a disconnection syndrome in the brain. So actually along these lines, this is just an example, you can actually create a profile predicting the brain disturbances according to clinical phenomena. I called my proposal clinical brain profiling, and I talked about this proposal with some people from the NIMH, especially people who are involved in developing this kind of direction. There is this initiative, research domain criteria, where mental disorders are attempted to be reformulated as brain disorders. But most people think that it is too early to propose a specific translation of clinical phenomena to brain phenomena. But I argue that there isn't some kind of circular effect. There is a Chinese saying that wisdom begins by calling things by their correct name. And if we want to achieve a brain-related psychiatry, we must begin and reformulate mental disorders in terms of brain disorders. So clinical brain profiling could be a good starting point, and it's available on the web. Just type neuroanalysis, and you find this website where if you go to the brain profiling part, then you can actually have a detailed information of how to use and how to make this transition.